Next, we have with us Dr. Naren Shetty, who's HOD Cataract and Refractive Surgery from Naren. He's won a travel grant for ARVO and in 2015 and has won the best postgraduate scientific paper in the State Conference of Karnataka Ophthalmological Society in 2012. He's won the best paper award in APACRS in 2022. Today we have with him a patient who's a 64-year male being operated for the right eye cataract surgery. This is the biometry for this particular patient, and the IOL implantation is planned for 24 diopters. He's going to show us the MyLoop in the 3D. So I request all of you to put in your 3D glasses so that you can enjoy the surgery in 3 dimensions again.
So thank you, Dr. Amrita, and very good evening, everybody in the audience there. This is Dr. Gaurav Luthra from Drishti Institute, and we are good evening to the chief guest and all the dignitaries on the dais. We have with us Dr. Naren Shetty, who is one of the top surgeons, cataract surgeons from Naren in Bangalore, and we are going to show a 3D transmission on the Zeiss RTO system. He's going to start on this case immediately, and I'm handing over the mic to Dr. Naren Shetty to go ahead, please.
Thank you, sir. Thank you for the opportunity. Thank you for inviting me over, and also thanks Zeiss for giving me this opportunity. So today, भैया सिर्फ लाइट को देखने का, इधर उधर नहीं देखने का. दर्द है? Saline, please.
Dr. Naren, the Honorable Chief Guest, Governor of Uttarakhand is watching your surgery. Please explain the surgery.
Oh yes, definitely. Hurricane, please. Hurricane. Yeah. Side port, please. So basically, we'll be doing small openings in the eye. सिर्फ लाइट को देखने का सर. Very nice. बहुत Back again.
This cataract surgery is being performed under topical anesthesia. Yeah. Topical means no injection.
Only
no injection. Drops. Only drops, anesthetic drops.
So basically, the patient is previously they used to give injections and then do the surgery, but now I think we have stopped that. We are doing under topical anesthesia itself, and so as you can see, I'm looking at a screen and then doing the surgery. There's a little bit movement of the patient.
You can see a spot, white spot in the center, that is cataract obstructing the view of the vision of the patient.
Yes. So light को देखने का सर, आंख को हिलना मत.
So the advantage of the 3D system is, which is a very new system and available at very few places right now in the country, including at Naren in Bangalore and now at our center over here, is that the surgeon does not have to look through the microscope. The surgeon can look at a big screen, and he's operating now. You can see he's wearing 3D glasses and he's looking at the big screen. And the advantage is that the patient also has very low illumination, and the accuracy and this thing of the surgery becomes much better. This is a digital microscope which Dr. Naren Shetty is using right now. Absolutely. And through that, you can have a screen which is almost as big as 5 feet across. And the surgeon has an amazing view, and it is also a very great teaching tool for fellows and residents because they can see the whole surgery in 3 dimensions as well.
Yes, absolutely. So basically, I use the saline now to separate the lens from the viscoplease, from the lens from the bag. So the key is in this particular, there is also an instrument, something called as MyLoop, but it's very ideal for NS2 and above. This is a little more softer cataract. So it's better we go ahead with the phaco itself. In a harder cataracts, MyLoops work well, NS2 and above. This is a little more softer cataract.
Small film in front of lens, that is known as capsule, has been removed.
Yeah.
Now he's removing the main part of the lens, that is called nucleus. First he will differentiate this nucleus,
yes.
Then cut it and remove it.
If you see my main port also, I created extremely short and very nimble.
Size of incision is 2.2 millimeter.
Yes. So what we are trying to do is, it's like a pizza. What we are trying to do is, we're trying to cut the pizza into quadrants, and then separate it. Okay. So that's one. Very small strokes. a little bit of bubbles. So what we'll do is we'll remove the bubbles and then we'll continue. Visco, please. Visco. So that the clarity is good. I hope you can see. Is it visible there?
Very well.
So we are also using a very new advanced
dial up,
emulsification system, and Dr. Naren can tell us a little bit about the Cotera, which is a Zeiss ultra modern new machine which has lots of new things in it.
Yeah, absolutely. So Zeiss basically is a German company, and this is one of the latest and one of the best phaco machines in the market right now. So basically, it has an advanced 4 pump with which it has absolutely fantastic control about the fluidics or how the things are going in. So you can see now I've chopped it into many quadrants like a pizza, and then we have to remove piece by piece. सिर्फ लाइट को देखने का, आंख को हिलना मत. So you can see, so the machine slowly eats it up. So what you can do is remove the central piece. I usually remove my second hand instrument so that you see through the side port there's no fluid leaking. The chamber is much more stable, and you can see how seamlessly it's eating all the pieces.
So for the benefit of those who are not medicos, they have divided the nucleus in small pieces, and an advantage is that you can take it out from the small opening.
Yeah, absolutely.
That do not need any stitching. This is for the benefit of persons who are not medicos here.
Absolutely, sir.
For our chief guests also. So
yes, sir.
We can remove the nucleus from the very small opening, sir, and we do not have to give a stitch here. This is the advantage of this technique, sir.
So basically, previously they used to make large openings so they can take the cataract as a whole. But now what we do is, because of this latest phaco machines, through the small opening itself, we are able to remove all the pieces.
So that is the benefit, is that today a cataract surgery patient next day onwards is able to do almost everything. They can go to work if they want within a day or two. They can, the precautions are much less. The recovery is very fast, and they're comfortable. And most of them are seeing 6x6. Like the last line on the chart, they can see even from the first post-operative day. In fact, today we showcased also some laser-assisted surgeries, which are also making cataract surgery much safer and better. And
so this is called bimanual. What we are trying to do is remove the left eye, please. Yeah. So basically, I'm trying to remove the rest of the leftover lens particles, which is called the cortex, and so that the bag is nice and clear. So you can see as I try to remove, the bag is becoming more and more clear. Light dekhiye, please.
So initially, the nucleus was removed. After that, remnants of the nucleus, we call them cortical matter, they are also removed.
Yes.
Now this has become a bag of cataractus lens. Had a bag. Inside this bag, we will fit in the plastic lens, which will be folded. Let's see how
we are using a preloaded Lucia kind of a lens, which is a very new lens from Zeiss, and it's much more advanced from the previous version. And Dr. Naren is going to plan. He's going to tell us about it also.
So this is that's fine.
So this lens is folded inside the injector. When it goes inside, it unfolded. So we can implant a 6 mm lens, optic size, from that 1.8 mm either.
So basically, the beauty about this is all the lenses actually in the future we're going to implant like this. These are called preloaded. That means there is no human contact of the lens. Directly the lens is implanted into the bag without. This prevents, the infection rate and other things. So that way, there's the chance of other complications or damaging the lens by the humans is not.
Narendra, you have done under the hydro?
Yeah, only under hydro. So I don't put visco. So this one is generally my one step of removing the viscoelastic is lesser, and also what happens is also post-operative the visco remaining in the chamber is not there because I don't use anything, no viscoelastic at all.
So,
IOP spikes are not there, post-op.
Absolutely.
That's the other advantage.
so
I've
in
been
this surgery, we have not to give any stitch. It is without any stitch. This surgery is done. This is the beauty of this phaco-emulsification.
Yes, absolutely. And so now we're just closing the side ports and main ports with the help of saline, just water basically. So that way it's a self-sealing wound. So there's no sutures at all. So you can see there is a good overlap of the rexus and the surgery is done.
So
Thank you for your time.
Very good surgery, and congratulations. Very well. Thank you.
Applause for the surgery.
So, Dr.
We have
Rohit
removed
Prakash
the
is
white
also here with
cataract.
me. Dr. Satanshu, I have with me Dr. Rohit Prakash also, who has just done another same surgery on just before Dr. Naren Shetty. And I was going to ask him about his experience with he's also using the 3D system like Dr. Naren and like what we are using here.
I think it is a good. There are multifactorial advantages of this 3D system.
You want to ask anything?
Thank you
sir?
so much, Dr. Gaurav Luthra
operating-
and your entire team for such a wonderful live surgery. Can we have a huge round of applause for Dr.
maybe,
Gaurav
for
Luthra and
people-
team out there?
So just a small thing. See now, basically, if you look at the patient, this is how it looks like.